In comes this thing called generative AI. There's possibilities of it from here, but the hype cycle has really gotten a little out of hand at this point.
I absolutely agree. I absolutely agree. It's still baby steps at this point. We give it a whole bunch of progress notes, and Epic or the AI mistakenly picks all the physical therapy notes. What about the heart disease? We ran out of space to incorporate those progress notes. So we're still trying to teach it what to look for, what's important, and that sort of thing. What we're working on right now is a partnership on replying to patients. During the pandemic, as our incoming patient message volume tripled, 350% increase from 53,000 a month to 190,000 messages incoming per month. It's an unsustainable work that clinicians start that work after 5 o'clock, right? You have a full day of seeing patients in clinic or in the hospital, and you go home, and guess what? On the average primary care doc has 20 to 50 more messages to deal with every day. And it's an enormous burden. And we thought applying generative AI to draft a reply might, in some fraction of cases, handle this volume. And we've been trying this now for 6 months. And some of the best responses are when a patient says something pretty straightforward. I hurt my ankle. What do you think? And it does rest, ice, compression, elevation spectacularly, and it's very friendly. Thanks for your message. Oh, I'm sorry, that ankle must be really uncomfortable. Here's some good advice for you to try for the next few weeks, and then let me know if it's not any better. And the physician looks at the generative response and goes, that's terrific, send, no typing, and the AI has written a very reasonable response. There are the things that AI does terribly, where the patient sends and says, hey, that CAT scan was really hard to understand. What should I do about it? The best it can manage it. It's important to see your regular provider to come in and have a discussion, and that's completely useless. One case of our rheumatologist, the patient sent in a message saying, swallow knuckles. The message title was swallow knuckles. Okay, that doesn't make any sense. And then the entire body of the message was, I have more pain. What should I do? And you would think there's no chance the AI can do a good job, but it read the last progress note from the rheumatologist who said, your rheumatoid arthritis, and so the reply says, your rheumatoid arthritis is probably the cause of your swollen knuckles. And as was recommended at your last visit, you should take the anti-inflammatory prescribed twice a day and let us know how that goes. That's phenomenal.
That's amazing.